welcome to this episode of News Audit. I'm Deepavali Hazra. With me is my colleague Anubhuti Gaur. In this episode, we're going to discuss the fast becoming pandemic of coronavirus. As far as India is concerned, on the 9th of March, that is today, the number of confirmed cases of the coronavirus has risen to 43. In this episode, we're going to look at exactly where the disease is spread across in India, who are these people who've contracted the virus, how they came to have contracted the virus, what is their case history. Next, we're going to take a look at, we're going to bust a couple of myths about the disease and talk about a little bit about the prevention, considering we have Holi tomorrow, in which large gatherings are the custom. And finally, we'll take a look at the coronavirus outbreak across the globe. So to start off, Anubhuti, can you take us through how the disease is spreading across India? It is controlled, but of course, the number of cases are rising steadily.
Well, as we've seen, the number of cases are rising across the world, and so is happening in India as well. And that is the big cause of worry, as we've seen that out of these 43 cases, leaving out those in Agra, where the Delhi man who was infected with coronavirus had visited his family, and that is the reason why they got the virus. Apart from that, if you look at the other cases, then most of the people have a travel history. So as we know that the government has sprung into action, today also there was a meeting chaired by the Union Health Minister with the Delhi CM, the Lieutenant Governor, and all were part of this meeting, and the government has said that has directed all the states to formulate a rapid action task force in order to curb any kind of spread of the coronavirus. So as we've seen that today, if you look at the cases that have been reported today, for the first time ever, a 3-year-old in Kerala has been tested positive for coronavirus, and the family had a travel history to Italy. If you look at the case of the first case in Jammu and Kashmir, where 63-year-old has been tested positive for coronavirus, even that person has a travel history to Iran. So as we see that the countries like Iran, Italy, Dubai, and all other countries where the virus is spreading, those are the countries, if you're traveling to that particular country and you're coming back to India, then it should be mandatory, and it is mandatory for you to get yourself screened. But the problem is that as we've seen that the 5 cases that were reported yesterday in Kerala, the 3 members of that particular family, they had traveled to Italy, but they had not disclosed the very fact that they had a travel history to Italy. Of course, that would have alerted all the authorities.
Yes.
So that is the one major problem that is happening at this moment, and that is why the Kerala government has even advised and had even issued a stern warning against not disclosing their travel history, as the Union Minister also said today that around 9 lakh people have been screened. So the basic way out to prevent this kind of spread across the country is that there should be a screening, and people should themselves disclose their travel history.
Exactly. And now, considering the spread of the disease, this is not a drill anymore. Even if you're not showing any symptoms yet, the screening might be able to detect some symptoms of the disease, or something about the disease that kind of gives evidence that you might
maybe
contract
elevated
virus.
temperatures.
Exactly. So it is necessary to go through that. It's not a drill. This is absolutely necessary. And as a responsible citizen and as a responsible family person, you have to ensure that you take yourself through that standard operating procedure. In fact, even the government has escalated the screenings. Now, every flight entering India will be screened. And of course, people who are coming in from affected countries, especially China, Italy, and Iran, are being quarantined, and South Korea as well, they are being quarantined. So, of course, that is as far as travel is concerned, this is very important. In fact, Anubhuti, even I'd like to add here that some cases, in fact, Italy, which is now becoming, the cases over there are soaring. Fresh cases are appearing over there more rapidly than in China and South Korea, which were the erstwhile epicenters. Over there, the disease mainly spread after people failed to report themselves that they had arrived from countries that have been affected by the coronavirus. And then at that stage, perhaps they didn't show symptoms, but when the symptoms were detected, it was already too late, and the virus had spread as the person who was infected had come into contact with several others.
And also, it is very funny that how a person who himself feels that he's infected with coronavirus, why would that person, the first try to hide it,
Yes.
you actually pose a threat to your own life if you're
Absolutely.
not really disclosing. For example, what has happened in Bengaluru, if you look today, the Karnataka police is trying to chase, is on a hunt for a man who was tested, who did not test, but he showed initial symptoms, and then he was taken to the hospital, and then his family members came there at the hospital and they took him away and he fled from the hospital. I mean, the entire scenario is very funny that he could just spread the infection.
Absolutely. So at this stage, it is important to listen to medical service providers and not take decisions on your own. Right now, I would also like to take you through some of the myths that are doing rounds on WhatsApp especially. Please don't believe those WhatsApp forwards that tell you how you should be fighting the coronavirus. There are very simple things you need to do. That is, pay attention to personal hygiene, wash your hands regularly, wash them with soap and water, or use some alcohol-based substance to clean your hands. If they're not soiled, if they're not visibly dirty, you can just rely on these alcohol-based hand sanitizers. Otherwise, if it's soiled, then please go ahead and wash your hands properly. You do not need to wear a mask if you yourself are not coughing or sneezing or infected by the virus. That is something even the health minister today in a press briefing told the public. There's no need for alarm also, although, of course, steadily across the world, the disease, the infected confirmed cases are rising, but there is no need for alarm at this stage. And all you need to do is, once you see these symptoms, which is the symptoms are of common flu, which is of coughing, fever and shortness of breath, you see any of this in yourself or in people around you, make sure you report to a medical service provider and preferably maybe call them first instead of directly going to the clinic. Right, and of course, considering tomorrow is Holi, that is the 10th of March, and many places Holi is already being celebrated today, that's the 9th of March. It is also recommended to stay away from public gatherings. However, of course, considering it's such a popular festival, unlikely many people will do it. But if you're concerned about your own health and well-being, then of course it's recommended that you stay away from festivities this time, as many union leaders, like even the defense minister and the prime minister, have chosen to stay away from festivities this time. So that was the overall picture as far as India is concerned. Now, Anubhuti, if you could just take us through what's happening across the world.
Well, of course, as we know that the epicenter of the entire coronavirus was China. There are more than 80,000 cases have been reported in China and deaths have been more than 3,000. But if you look at it, in South Korea was earlier per place where the number of deaths and number of infections were on a rise after China. But now, since some time now, the number of infections, the latest reported infections have been less in China and South Korea, who seem to have gotten a kind of control over the virus. But now Italy has become the biggest epicenter of the disease. Every day, more and more number of deaths and infections are being reported. The death toll in Italy has risen to 366, which is a huge number. And if you look at Iran, the death toll has risen to 237. So, of course, we know that even in the Europe, in Germany, number of cases has surged, has passed beyond 1,000. So, as we see that the countries who earlier were reporting more number of cases, now they are being replaced by other countries. So, as we've seen, there's kind of a pattern that after some time, the number of cases are rising in a different country.
Right.
So, you cannot be sure whether your country will not have an outbreak in the coming days.
Correct.
So, we have to be extremely careful. We have to screen all the passengers coming from all these countries and be sure. And you should self-quarantine yourself for 14 days at least.
Absolutely, and of course the government has stepped up efforts to screen people, and also some rescue efforts are currently underway. I must mention, from Iran, there are stranded students from Kashmir who are going to be brought back if they test negative for the virus. So there are preparations underway in that department as well. And the health minister also said that although India is dealing with this disease on a war footing and it's under control for now, but there is absolutely no room for complacency. And as far as citizens of this country, we must ensure we do not spread fake news. We only believe verified sources of information, verified news websites. We go to WHO or UNICEF websites for information on the disease. Do not rely on WhatsApp forwards at all. And of course, take care of your health, take care of your personal hygiene, and wear masks if need be. And of course, trusted news sources is what you rely on at this stage. So that will be all from us for today. Thanks very much for watching. And if you have any queries on the disease you would like to ask us, then do leave us a comment below.